Hello, thanks for joining my talk. Thank you to Alex, the Leukodystrophy charity, for inviting me to give this presentation. And a special thank you to Karen Harrison, a good friend and outstanding advocate for ALD, for the invitation. I'm Dr. Troy Lund at the University of Minnesota. I'm a pediatric blood marrow transplant physician. I also have an interest in ALD and see many of the boys in our ALD comprehensive clinic. I'm going to be talking about predicting cerebral disease remission after bone marrow transplant and some of the new tools we're using. My disclosures at the bottom is that we are a site for Bluebird Bio gene therapy. So let's talk about cerebral ALD. I won't go into all the biology of ALD because that's probably already been covered, but specifically let's focus on cerebral ALD. It's really a demyelinating process followed by an inflammatory process. On the left side of the screen, you see a normal brain MRI with gray matter and white matter. The white matter are these darker zones here through the interior of the brain. And then you see an MRI that's not so normal, and these are this is an MRI. These are MRIs from boys with cerebral ALD, and you can see in the center one there's a large amount of white signal. This is all an pathological disease process. We call these T2 T2 signal enhancement or T2 demyelination signals, as opposed to the normal part of the brain, which is up here at the top. And then on the far right, what you see are T1 images after gadolinium and gadolinium contrast administration. So the contrast agent is a heavy metal delivered by IV during the MRI, and it generally stays in your blood vessels unless you have an inflammatory process. Oftentimes, this is used to diagnose brain infections or brain tumors, but in cerebral ALD, you can see we see a what we call a Garland ring of contrast enhancement, and we believe this to be part of the active disease process, and this is one of the things we focus on when we look at outcomes after bone marrow transplant. So what about cerebral ALD? Well, the complete mechanism of how and when and why cerebral disease starts is unknown. We do know it's a demyelination, and we do know that it's progressive. That is, it doesn't really stop on its own very often. There are occasionally boys that self-arrest, but this is not the majority. We know that steroids and immunosuppressants can only slow the destructive temporarily, and this only happens in some boys. I've certainly treated a lot of boys that weren't eligible for transplant with various immunosuppressant agents, and we would get at best a temporary remission, if any. We know the blood-brain barrier is broken because I showed you that Garland ring of gadolinium enhancement. That's an indicator of a broken blood-brain barrier. How that contributes to disease is not clear. But we do know the only way to arrest this disease is bone marrow transplantation. And that can be through a donor involving a brother or sister, an unrelated person, and now we have gene therapy. So I'm going to tell you about a cohort of boys. There are about 66 boys in our study. These are just the demographics of the boys. I give the age, the median age here is 8.3 years. The baseline LES score, which some of you might be familiar with, I'll cover the score in a few slides, was 9. The intensity score was 2. We measured CSF total protein, that was 37. Boys are treated by a variety of transplant types, non-myeloablative and myeloablative. Most were myeloablative, and the stem cell sources given as well. Most of them had received umbilical cord blood. 19 received marrow from a brother or sister. And then the cell doses are given as well as recovery time. So let's talk about the goal of bone marrow transplant, cerebral ALD, and the goal is really to get the cerebral ALD into remission. So as I mentioned earlier, in the active cerebral disease state, we do an MRI and look at the T1 T1 sequences, and you see this garland ring of enhancement from the gadolinium. And this is a boy 10 days prior to transplant. Well, this is the same boy 30 days after transplant, which is our first MRI, and you can see that it's completely extinguished. Um, this is what we refer to as cerebral ALD remission. And this is the whole goal of transplant, is to arrest that process and extinguish the gadolinium enhancement. And then thereby we hope to stabilize the disease from an overall brain involvement and also symptoms. Again, the goal is stabilization of the child and prevention or attenuation of progression, at least slow the disease process down enough where the boy can live a healthy life. So fundamentally, we'd like these boys to have gadolinium resolution as fast as possible. There's no benefit to having the gadolinium resolve at day 60 or day 100 after transplant, but we want it to go away as soon as possible. It's a bit like treating cancer. You want to have that cancer treated as fast as possible in the shortest amount of time. So let's talk a little bit about the gadolinium intensity score. It's a scoring system we developed a few years ago, and it's really a way to measure the whiteness of that gadolinium signal. So all these MRIs show gadolinium. The signal of the gadolinium of the disease process is indicated by the large white arrows in 1, 2, and 3. And we compare the whiteness of the signal to the choroid plexus, which is an organ in your ventricles that makes CSF, and it appears white on the MRI and serves as a comparator to the gadolinium signal. And the system is very crude. We score gadolinium intensity as a 1 if the signal is dimmer than the choroid plexus. We score it as a 2 if it's the same brightness, and we score it as a 3 if it's overly bright or brighter than the choroid plexus. So a very simple system. And then a score of 0 would mean you have no gadolinium enhancement. So let's take a look at boys with gadolinium resolution 30 days post-transplant. So this is our first MRI time point and the fastest that you can resolve your gadolinium, because that's our first time we look. And so I just simply plotted out yes or no, did the gadolinium go away? Yes is in blue, no is in red, and then according to their pre-transplant gadolinium intensity score, or GIS. And so I have 1, 2, and 3 at the bottom. And then we can see that those with the GIS score of 1 were about 60% likely to resolve their gadolinium post-transplant, while those with very bright gadolinium, so a GS of 3, only 22% of those resolved their gadolinium by 30 days. So, and this is statistically significant. So this shows me that perhaps the amount of gadolinium you have correlates to how long it takes it to go away. And this is somewhat intuitive, but had really never been shown. And so again, sometimes I think of the gadolinium as a surrogate for disease process. So perhaps this represents more severe disease, and it takes longer to go away. And so while we're continuing to talk about gadolinium, it's not just a line or a blip on the screen. You can see in figure A here, this is frontal disease in a boy and it involves this region here at the top of the MRI image. It's actually a signal that you could quantify. It has an area and a volume, and you can actually outline this area and volume on the MRI. And again, this is a boy 30 days prior to transplant, and here he is 30 days after transplant. That signal is completely gone. And so we can go from a GIS of a 1, 2, or 3 to a 0. But again, we can measure this by outlining this area. In fact, here's another way to do it. This is my crude, almost childlike drawing of the outline of gadolinium. And this MRI pictures in 2 dimensions, so it's a slice. But you can actually go through all the slices and add up all the area and make a volume. And so we call that volume of enhancement. So we thought this might be a new way to quantify the amount of gadolinium. Maybe it corresponds to the extent of disease, and maybe it corresponds to the time to cerebral disease remission after transplant. And so we didn't do it like I've done it here in this red outline. It was done with a much finer tool. So we did that in the cohort of 66 boys. And we get a volume basically of gadolinium. And this is a distribution of the volumes we have. It's not a normal distribution per se. You can see there are a lot of boys with very small volumes. So this curve is skewed to the lower end here, and this is another way to plot the dots, and so it doesn't follow a normal distribution. So what I did was just mathematically transform the data by taking the logarithm of the GAD volume, and now you can see we get a much more normalized distribution, and all of our dots fall on a straight line. And so I did this for every volume that was measured. I transformed it by taking the logarithm. And so all the data was treated the same. So then I just simply said, does this correlate to early gadolinium resolution? And when I use the word early, I'll just use that as a surrogate for 30 days, since that's our first MRI. I looked at the gadolinium intensity score, which I explained to you. I looked at regular volume, which we just went over. And then I told you I did a logarithmic transformation of the volume to make the data look better. And then I also did some calculations where I just took the volume and multiplied it by the score to see if that would make any difference. And I also took the log volume and multiplied the score. And then I just ran statistical analysis to see which of these correlated best with early gadolinium resolution. And it turns out that the logarithm of the volume enhancement gave me the strongest p-value and was highly correlative to early GAD resolution. And you can see the p-value shown here. It was superior to certainly our score, which was a crude measure at best, and it was superior to the other calculations shown here. Now this is just a breakdown of all the boys in the study. Again, log GAD volume is shown on the y-axis, and then did they resolve their gadolinium 30 days post-transplant? Yes or no. And you can see the boys with the lower amount of GAD volume were more likely to resolve their gadolinium by 30 days post-transplant, and the data is highly significant. I just need to cover a little, just to remind you a little bit about the LESS score. While I've talked about the gadolinium and GAD volume as shown in this upper MRI, I want to remind ourselves about the LESS score, which is shown below, which is a T2 sequence from the MRI that shows the number of structures involved in the demyelinating process, and it's essentially diseased white matter. It's a scoring system from basically 1 to 34, depending on how many structures on what side of the brain. This would be a low LESS score child here on the left, and a higher LESS score is shown here on the right. And so now that I've told you about that, what I did was look at other biomarkers we described associated with day 30 gadolinium resolution. That's our early time point. So I looked at the pre-transplant LESS score, and again, there was an association with lower scores, with boys having lower scores having their gadolinium resolve earlier. as shown in panel A. I also looked at a couple of other biomarkers, chitotriosidase, which is a monocyte enzyme we've previously described as a biomarker for ALD. We've looked at it in the plasma and in the spinal fluid, and that turns out to show us that if you have lower levels of plasma and spinal fluid chitotriosidase, you're more likely to have early gadolinium resolution. And then I looked at neutrophil recovery time after transplant, which is essentially a measure of how soon does your immune system recover after transplant. And this, in this case, it would be the donor immune system. And so I basically made a cut time of 16 days post-transplant, and I put the boys in the categories of, did they recover their immune system faster than 16 days or slower than 16 days? And did their gadolinium resolve? And so on the right side of the graph, you can see in the yes column, the boys that recovered their immune system faster had a greater likelihood of getting rid of the gadolinium by 30 days post-transplant, as shown by the blue bar, which is greater than the boys who had a very slow immune system recovery. They were not as likely to have gadolinium resolution early post-transplant. And so this goes to show that the whole resolution process is multifactorial. It involves biomarkers, but it also involves post-transplant immune recovery. In fact, I have other data that shows these immune cells, if they're in fact the donor cells, is even a better predictor of resolution. So I can look at a variety of data points and a variety of biomarkers that we've previously described, and I can see which are the strongest for early gadolinium resolution, which is what I've done here. So there's a whole different array of biomarkers, including the log volume of enhancement, which I've shown you, the score, which I've shown you is not a great predictor. The p-value is 0.04. In this analysis, recovery time was not as strong. I put in chimerism. I talked to you about a pre-transplant less score, which was a good predictor, and plasma chitotriosidase activity was a fair predictor as well. Same with CSF chitotriosidase. And then slower versus faster neutrophil recovery at 0.03. I also looked at the type of chemotherapy, which did not matter. Those are all univariate analyses. And so when you put all those variables into one calculation and ask the question, which of these is the strongest predictor of early GAD resolution? It turns out that log volume enhancement was the single thing that rose to the top to predict who was going to have that early GAD resolution, as shown here, indicating it's seemingly a pretty powerful biomarker. Now, does this have any functional consequences? I need to briefly talk about the neurologic function score, which is really a score of dysfunction. We assess boys before and after transplant as far as how they're doing neurologically. And in this scale, you get points for dysfunction. So if you have hearing problems or auditory problems, you get a point. If you have aphasia, you get a point. If you have cortical blindness, you get 2 points. Running problems is a point. Wheelchair, you get 2 points. You also get all the points leading up to the wheelchair. So you don't just get 2, but you get the spastic gait, the walking and the running problems. So you actually get 6 points for that. And then incontinency gets you points. So it's a 25-point scale. Most of us walking around should be 0 points. And when we see boys with ALD, of course, prior to therapy, is the lowest number is always a better predictor of outcomes. But this is the scale we use. It's not a fantastic scale, but it's what we've been using for a while. So what I did was look at the change in neurologic function. So probably what's most important in this scale is that we assess boys with a score prior to transplant, and they might be 0, 1, 2, or 3 points. But what you want to know is, what is the child looking at like at 1 year post-transplant? And so how many points has he gained, i.e. how much neurologic dysfunction has he experienced? And so our goal is 0. Though we don't always achieve that, but really we'd like to send the child home with no loss in function. Nevertheless, some children do lose ground, and so we quantify that with a delta. We call it delta NFS, and so it's the change or the additional points a year after transplant. And I looked to see if that correlated to early GAD resolution. And so it was really yes or no, did they resolve GAD early? And it turns out it correlates quite well. That if you resolve your gadolinium early after transplant, you actually gain very few points at 1 year post-transplant compared to those that did not have gadolinium resolution early. So it is important to get rid of that gadolinium as fast as possible. And then I took basically the boys that only gained 0 or 1 point, because those would be the boys that had the most minimal amount of damage, and I looked at their gadolinium volume and their ability to resolve gadolinium post-transplant at 30 days. So yes or no on early gadolinium resolution. Again, these are boys with a delta NFS of 0 or 1 at 1 year post-transplant. What did their volume look like? And you can see on this plot that the volumes of the boys with early gadolinium resolution were very low compared to the boys that did not resolve their gadolinium. So again, this shows that the volume of gadolinium actually is important. And in low NFS boys, the lower the volume, the better the outcome, and the earlier the disease goes into remission. So the highlights of what I've told you here is that the blood-brain barrier is disrupted in cerebral ALD, and this is indicated by gadolinium enhancement. Gadolinium volume can be quantified on a pre-transplant MRI. The gadolinium volume pre-transplant correlates to timing of gadolinium resolution after transplant. And in what I've shown you, I've focused on the early gadolinium resolution, which is 30 days post-transplant, which is our goal. And that early gadolinium resolution after transplant is associated with less neurologic progression when we assess the child 1 year post-transplant. So, of course, thank you to all the groups that are advocates for us and help us raise funds to do the research. Knockout ALD, Xout ALD, Oliver's Army, and of course, all the families. And special thanks to our ALD team back home. One of our fellows, Michelle, helped me put this together. Dr. Ashish Gupta, Dr. Paul Orchard, my colleagues who work with me in the ALD clinic, Dave Nassina, neuroradiologist, Dr. Les as well, Dr. Raymond, and Dan Kenny Jung, our neurologist, and Ms. Mietinen, who also helps assemble some of this data. Now, in the last 2 slides, just a teaser for the next one of the next ALD conferences coming up. I've talked to you a lot about the blood-brain barrier, and in ALD, what you see on the screen is that that's a blood vessel within the brain surrounded by endothelial cells and astrocytes, and it's leaky. And so it's the red arrows, which allows fluid to leak out, and gadolinium, and gets our signal and gives us that ring of the gadolinium signal I showed you on the MRIs. After transplant, something happens to this barrier. We're not sure what, but anti-inflammatory factors or anti-inflammatory cells come in, and the barrier is sealed up, and it's not leaky, and the gadolinium enhancement goes away and is not allowed to leak out. So at one of the ALD conferences in the very near future, this will be ALD Connect's annual meeting and Patient Learning Academy. This will be virtual. It's November 13th and 14th. I'll be talking to you about potential new ways in which we can induce this cerebral gadolinium resolution without a transplant. So again, going from this MRI to this type of MRI where the gadolinium is completely gone, and doing this without having to do a transplant, i.e. using only medicines. So that's my teaser for this upcoming ALD Connect annual meeting conference. So thank you for listening and tuning in, and I'm sure we'll be able to have some questions at some time during the meeting. Thank you.